Hello everyone, this is Raymond Lee from Raymond's Dental Solutions. When people talk about high-end CO₂ lasers in dentistry, one name that almost always comes up is DEKA SmartXide². It's a powerful system widely used in hospitals and surgical centers. And on the other side, you have Yoshida, a CO₂ laser designed purely with dentistry in mind. So today, this is not just a brand comparison. This is really a comparison between a multi-specialty surgical platform and a dental-first engineered CO₂ laser. Both use articulated arms. Both deliver 10,600 nanometer CO₂ energy. But how they behave in dental operatory, how they feel in the clinician's hand, how they integrate into daily workflow, and how they impact long-term ownerships are quite different. Let's walk through where those differences come from. First, what they share. Both DEKA and Yoshida use articulated arm beam delivery. So structurally, the concept is the same, but in real clinical use, the experience is very different. DEKA is designed as a multi-specialty platform. Its articulated arm is long, relatively heavy, and integrated with multiple modules such as scanners and aperture. In a dental operatory, this means you feel more inertia during fine movement. Precise positioning requires more attention. Yoshida follows a dental-first design philosophy. Its arm is relatively lightweight, well-balanced, optimized specifically for the working range of dental procedures. So, even though both use articulated arms, the difference in design intent creates a clear difference in real-world handling. Now let's talk about space. Most dental clinics have limited operatory room, care about equipment mobility, and value smooth workflow. When clinical performance is comparable, footprint becomes a very practical decision factor. DEKA has a large console, heavy system weight, a footprint closer to operating room class equipment. Yoshida is sized specifically for dental operatories, compact, relatively easy to move and position. So in everyday practice, many dental clinics naturally prefer the system that occupies less space and integrates more easily into the room. Next, the aiming beam. DEKA uses a red aiming beam. It's adjustable in brightness and follows traditional medical standards. Yoshida uses a green aiming beam, and that color choice has real clinical meaning. Green light provides stronger contrast against red oral tissue and blood. Excellent visibility under bright operatory light. Clear confirmation of the focal point before firing. Clinically, this translates into more accurate initial targeting, scalpel-like precision, greater confidence, especially in bleeding environments. In the red dominant environment of the oral cavity, a green aiming beam offers a real visibility advantage. Now let's look inside the systems. DEKA integrates multiple PCBs, extensive software, sensors, interlocks, and scanning components. This creates a very sophisticated platform, but also introduces more potential failure points, greater dependency on electronic stability, ongoing maintenance attention. Yoshida takes a different approach. Its design is structurally simplified and focused on core clinical functions. By minimizing unnecessary electronic complexity, the system reduces the number of failure points, improves long-term stability, lowers the maintenance energy required over time. From an engineering perspective, structural simplicity often translates into higher real-world reliability. Finally, let's talk about long-term ownership. DEKA is based on a glass CO2 tube system. Over time, this may involve tube maintenance or replacement. A wide variety of handpieces, apertures, and tips, individual costs for each accessory, increased inventory and management burden. Yoshida uses a long-life laser source, a simplified handpiece structure, very limited consumable and accessories. From a total cost of ownership perspective, DEKA tends to experience repeated high-cost events over the years. Yoshida offers more predictable cost, lower risk of sudden major maintenance expenses, a more stable long-term ownership model. Even with the same CO2 laser technology, some systems require continuous management to operate, while others are designed so clinicians can simply focus on dentistry itself. Thank you so much for watching, and we hope this overview was helpful.